Welcome back to Lisa Moss Medicare. Now, I am not a federal Medicare work for them or work for the Department of Medicare. What I am is I'm a licensed agent, a licensed insurance agent within the Medicare field. And that's all I do is Medicare. I'm a broker. I work with all the different companies in my area. And if you're not in my area, I work in Idaho and a couple of other states. I will find somebody that can help you with your Medicare. It's really important to have an advocate that can be on your side to help you. And the best part about it, we don't charge anything. We're free. Well, not free exactly, but we get paid by the companies and we get paid by Medicare that pay the companies. So we don't charge you anything. We are a service that come with your policy. And then if you don't know who your agent is, and they say the statistics are 80% of people don't know who their agent is, it's really important this year coming up in 2025 that you check in and know what policy you're on and what changes are coming up, because we're going to see a lot of new changes coming up for 2025. Today, what we're going to do is we're going to talk about Medicare denials. It doesn't happen very often. However, when it does, it can be really frustrated and also really expensive. So what's going on? Let's talk about that because it can be a very frustrating issue. There's several reasons why your claim can get denied. There could be administration errors. There could be improper coding. It may not be Medicare necessity, so you have to make sure that. And we'll go through all of these things. Prior authorization. And the good news is there is an appeal process. And we're going to talk a little bit about that today in detail. Now, if you have challenges along the way, you can always contact me if you're my client. If you're not my client, I can still kind of guide you and tell you what to do and where to go. And just check in. If you've got questions, give me a call. The number's on the bottom of the screen. You can also email me through the website, insuranceover65.com. All right, so let's get into today's talk. Denials. The number one thing of why people get denied is administration errors. There's mistakes in paperwork. So you want to make sure the practitioner in that office or in the hospital double check or have them double check the paperwork that they sent in. There may be an outdated code or an improper coding. There's errors that occur along the line. It happens in everything, every field. Nobody's perfect. So that's the number one thing. And that can be done fairly easy to remedy the situation, is just sending in another code, having them call the company and updating their information, and voila, your challenge is taken away. The second part is a Medicare necessity. Medicare requires that the services and items are medically necessary. So if you're going in for an operation, say to staple your stomach, and it's a health crisis that your doctor sent you for, Medicare will probably take care of that. You want to make sure ahead of time, of course. But if you're just going in for vanity reasons and you want to lose a little bit of weight and you bill it to Medicare, they're not going to take care of that. That's just one example. There's lots of different examples. So you have to make sure in the Medicare field that it is required and it is a necessity. Your doctor can send in the paperwork. His office can send in the paperwork. You just want to make sure that it's covered before you go into surgery. The next thing is prior authorization, especially if you're on a Medicare Advantage plan. There's specific coverage limits and exclusions within operations, within companies. So you want to make sure that your limits and ensure that your services are provided and that they cover those limits. You may be going outside the limit. They'll cover a portion of it. However, you want to do that before. The area that I live in, the hospital is really good. There's a line that you can call. You can let them know what policy you're on, who your doctor is, and what operation is coming up for you. And they'll let you know everything of what it's going to cost you personally, what your copays and deductibles are, how much is coming out of your pocket, if there's prior authorization, and what limits are covered. So we have a service like that at our hospital. If you don't, you can ask your doctor to do that for you, or you can always call your agent and have them jump in and help them. The next thing is, if they do deny you, you can go through an appeals process. You can contact your provider, you can contact your beneficiary, and check to make sure what appeals process is. So if you get a claim denied, here's what you do. First of all, you're going to get a letter in the mail. You want to read this letter very carefully. It's called a Medicare summary notice, or an explanation of benefits for the denial. First off, get that letter, make sure you know the date on it as well, and check for errors. First, check for your coding errors. Check with your provider to make sure there weren't errors sent in. They can compare your notice that you get in the mail compared to what they did for you. So that's the first thing you want to check, is check for errors. You want to contact the provider. And then if there aren't errors and you still feel like this is a problem, then you can file an appeal. The first appeal is called a request for redetermination. Now you have 120 days from that letter that you received in the mail. So make sure that you don't go past that 4-month or 120-day window from the date on the letter to file the appeal. When you do, you want to make sure that you have supporting documentation for the request for redetermination. Now, if you get a denial for the redetermination, if that's denied, you can request a reconsideration. Now, you have to do this with a qualified independent contractor within 180 days. So the first is your redetermination. The second is your reconsideration. 120 days, 180 days. Now, if they deny that, then you can go to an administrative law hearing. It's ALJ, administrative law judge hearing, basically. So you're going to take that reconsideration in, and you're going to appeal it to the judge and request for that to be appealed. If the appeal council, it's denied, you can go to an appeal council. If the appeal council denies you, your last thing is to go to federal court. You're going to file a lawsuit and dispute the claims. Very, very rarely does that happen. Has it happened? Yes, of course. It's happened in the past, but it's very rare. Generally, there's a coding error, or there's an error, or there's something that you went outside the realm of what Medicare covered. That's usually what happens. But if you don't think it's correct, make sure you get that letter and file your appeal. You can get help from us as your Medicare agent. You can also get help from Medicare. You can call them directly. You can go online, medicare.gov, and find somebody that can help you with that. The best thing is probably to go to your doctor first, contact your agent, and let them help you as well. So that's the appeal process. That's if you have any challenges, your medical denials, they don't happen very often. I want to tell you that up front. But I thought it would be a good subject for us to cover, because once in a while it does. So it's really important before you get an operation or before you request a service to find out exactly what your policy covers. Your agent originally ought to have given you a booklet of everything your policy covers. And remember, the policies go from January 1st to December 31st for Medicare Advantage, and also standalone drug plans. Your supplementals are a little bit different. They usually cover most everything that Medicare covers. They just are paying your 20%. So they're a little bit of a different animal. And I'm stressing in all my videos is make sure you check in October 15th through December 7th this year for the new changes coming up for 2025, because we are going to see changes and all the companies are doing changes this year. For me, I will, as we get a little bit closer to October, I'll let you know where I'll be. So if you want to come to that region, I can certainly help you. Let's see that we don't have any questions today. So I'm going to pop that banner up real quick again. That has my information. If you want to contact me directly, I'm happy. Can't talk today. I'm happy to help you anytime with anything Medicare related. Have a great weekend. We'll see you next week. Bye for now.